kitty cat says someone is trying to call you.
Okay. Yeah, okay. And so, you know, we did a shout out to you during the first show, during last night's show. But you want another shout out now during our Thursday show? He's telling me that he sees this giant straw sticking up out of the water down that storm drain in Times Square, and he thinks it might be Trump. Well, oh no, I guess that was the guy that plays Trump on Saturday Night Live that I'm thinking of. Okay, well, I know you don't want to go down there because you don't like to. You're not a great swimmer, Basil. But see what you can find out and report back to us, and I will see you on Friday night's show. Bye. So, welcome to Progressive Soup. My name is David Stevenson. I have with me, well, I'll call her a youngster because she's a little younger than me, just a bit. And we met at the Dick Blumenthal event on Saturday. Senator Richard Blumenthal came to Western Connecticut and spoke at length, and had a very different type of event than what we're finding in Republican districts all over America, where candidates are coming and pretty much getting booed off the stage by everybody because of what's going on in Washington. But first of all, introduce yourself, tell us who you are, and where you came from, and what brought you to this place and time.
So my name is Sarah Kettler, and I am a writer by profession. I am becoming more active in politics ever since our November election, which I see as a watershed event in our democracy to protect it. I also have become more and more of an advocate for improving the American healthcare system. I am not a policy expert, so I won't present myself as such, but I've had the opportunity to work overseas. I taught English abroad in both France and in Japan. And as such, I was living there, and I was a participant in their healthcare systems. So many people in the United States say that we have the best healthcare in the world, and you can't do anything with it because if you do, we could lose the best healthcare in the world. And I have firsthand experience that I can tell you that France and Japan have better healthcare than the United States.
I have an occasional co-host who was dual citizenship American and Italian, and she spent time in Italy, and Emily says that, quick shout out to Emily Volpentessa, licensed massage therapist. And she relates the same thing about Italian healthcare.
Yeah.
You may not be able to get cosmetic type things paid for by the healthcare system, but you get pretty good basic health care. Is that what you found to be the case in France and Japan?
Yes, exactly. You have a healthcare system that understands that that universal coverage benefits the entire population. If you are sick, you go to the hospital and you don't delay going there, because in the United States you can be afraid of a bill that could be in the high 4 figures, even 5 figures. And God forbid if you go to a hospital that's out of network, and the bill can climb even higher. Whereas if I have had to go to the hospital in Japan and you have a copay, if you don't have a supplemental insurance, which usually comes through your employer, then you would have to pay a larger copay than I did, but my copay was about $50 for a hospital visit. And that meant that...
That's pretty reasonable.
It meant that when I was feeling unwell, I didn't have to do a balance check of, is this worth risking $1,000 or more to get taken care of? And fortunately, I was checked out. Everything was okay at the time. I had coworkers who, I was in a very snowy part of Japan, very icy. People fell, broke legs, had to stay in the hospital for longer than I did. It still was a very reasonable fee, maybe for an actual hospital stay of a couple of days, $100. And it's something that people shouldn't be making a calculus of, I'm sick, can I get care or not? America is a wealthy country. Mm-hmm. We can afford to care for our citizens. Right now, we are choosing not to. And the Affordable Care Act, I think, was a good step in the right direction. I don't want to see it changed. The Republican American Health Care Act is an abomination. It would strip coverage from people who need to buy on the open market and who have a pre-existing condition. It would hurt children. It would hurt older people who are not yet eligible for Medicaid, for Medicare. Mm-hmm. It would cut across the population. We have a choice that we can say, what is not working in our healthcare system? What are different ways that we can improve it? Stripping healthcare away from people is not an improvement.
You mentioned before we came on the air about, you mentioned a pre-existing condition of yours.
Yes.
I had one. I have a story to tell too. You can go first.
I actually have 2 pre-existing conditions. So when I was in my 20s, I was given a diagnosis of polycystic ovarian syndrome. And it is a hormonal imbalance. Mm-hmm. It can do things like increase your chance to get diabetes later in your life. But basically, with an inexpensive medication and taking care of yourself, you can live a long, happy life.
Almost takes it off the table as a life changer.
Yeah, except with this pre-existing condition, when I applied for insurance before the Affordable Care Act, also known as Obamacare, mm-hmm. I was paying a couple $100s more per month than somebody who didn't have this pre-existing condition. Mm-hmm. A few years ago, I got a herniated disc in my back, and I have now had back surgery. I have a bulging disc. These are things that, with care, shouldn't affect me, but when you add them with my other pre-existing condition, without the Affordable Care Act, on the individual market, I would be uninsurable.
And that appears to be what we're going to find out from the Congressional Budget Office when they release their report. But, you know, we may be wrong, but no, we're not going to be wrong. It's going to be very clear that people with pre-existing conditions are going to be, through cost add-ons for health coverage, are going to be, unless they're wealthy, are going to be unable to afford even basic health care. And very briefly, mine, my dad died of my dad died of a heart attack, and because of that second generation, I was uninsurable because I'm related to someone that died of a heart attack. So
and it hurts. I think that it hurts the entire economy to do that, because if I get a corporate job, mm-hmm. then I would most likely, if the company had good insurance, I would be covered. So I would look for that type of job. Mm-hmm. Currently, I work as a writer. I write fiction. I work as a copywriter. I am self-employed. Mm-hmm. I am paying taxes. I am contributing to society, but I would not have that choice any longer if I could not get insured with an individual market policy.
This is a problem that existed before, in that people would stay at a job
Job lock.
that they hated because they didn't dare leave, go to another company, go for health insurance, and be denied.
Yeah. And I'm a writer, but there are people with pre-existing conditions who probably have wonderful ideas to start new companies that could expand and hire other people. Or there are people who have children who are sick, but if they had insurance, they could go and start a company that could benefit everyone. If you like taking Uber or Lyft, those companies, I don't agree that their drivers should be contractors, but right now they are. How could anyone drive for them if they're not getting insurance through a family member? If they're on their own, they need an outside way to be able to get health insurance.
Absolutely.
Or do you really want to get into a Lyft that has somebody who is coughing and hacking because they can't afford to go to see the doctor?
And that became an issue here with Connecticut with paid sick days. We
Yes.
brought in paid sick days because up until then, you'd go to a restaurant, and if your wait staff or someone in the kitchen couldn't afford to take a day off because they weren't getting paid, had to go to work, coughed on your tomato soup in the kitchen or coughed on your plate as they were bringing it to you, one person sick at work could literally get dozens of people unknowingly sick going to that restaurant to eat. And that's just...
It was an impossible choice for them because they're sick, but if they don't go to work and they lose their job, then
a day's pay, losing a day's pay will ruin some people.
You lose your job, you could not make rent, I mean, it's a horrible calculus, and it's something that in America we shouldn't have to be making these kinds of decisions.
Absolutely. From a moral, ethical, from a fiscal standpoint, from any of those standpoints, it's the way to go is to have everyone get good preventative medicine, whether it be through a health insurance policy, but at the very least seeing a healthcare professional when they get sick.
That's actually another important point that you mentioned, is that preventative care. If you don't have health insurance and you have a headache, then you say, okay, I'll wait for it, and fine. Everyone waits a day, take an aspirin, but then you don't have health insurance and your headache has been there for a few days and it doesn't go away. And you could put off seeing the doctor while you're experiencing a stroke or you have cancer. You have things that, if they are caught earlier, can be treated for less money. There is a Republican congressman whose name I'm afraid I don't know at the time, but he has recently said that if somebody has diabetes, they don't deserve to have health care.
Really? Interesting.
The calculus behind it is that you have made the decision to eat poorly and not exercise.
And diabetes is always a result of...
It's ridiculous. Yeah. That is where they're coming from, but it's ridiculous. Not only does diabetes not always come from poor decisions, people also live in food deserts where they can't eat fresh fruits and vegetables.
Yeah. In inner cities, there are generally no... You have grocery stores that only carry stuff that's pretty much crap, and they don't really
crap that's expensive. So you or maybe the crappier stuff is less expensive, so you're not making a lot of money. You buy that. There are a million decisions that can go into it, and it can also just be poor environment. Like, say you have chemicals being released into the water that could affect it as well.
Not by anyone's decision.
No, nobody
or
decides.
Knowledge generally that things are being introduced into their world without them knowing it.
Yeah. But say that this person, they get diabetes. This Republican congressperson doesn't want them to be treated. It would cost more money in the end because their diabetes gets worse. They go to the emergency room, and they're required to get life or death treatment, life or death emergency care. So they have a foot that if it's not amputated, it could kill them. And so if they go to the emergency room, you pay for an amputation that maybe could have been avoided if you had helped this person get care. And then what, you kick them out on the street afterward? It's, the Republican healthcare plan is unconscionable. And America...
And it's not often that we use the word unconscionable. That's a pretty heavy word to throw around because it means not showing any conscience in making a decision or making a statement. But truthfully, this unconscionable fits what's going on.
An accurate word.
It's not an over dramatization of what's happening. It's people that either have no conscience or probably more likely are pushing their conscience somewhere where they can't see it.
Or they tell themselves stories to convince themselves that people don't deserve care.
They lie to themselves, yeah.
They're lying to themselves. And we don't need to do that. The other thing that, if you are overseas, I received quality care. America has the most expensive healthcare system and some of the worst outcomes for wealthy countries.
Our healthcare is over double per capita than any other country in the world. Any of the countries in the world that have universal single payer or some form of that.
Universal health coverage.
Including Australia, which President Trump recently praised for having better health care than America. And he was right. Unknowingly he was right because he probably didn't know that they have universal single payer health care there, which he, of course, yammers against constantly, but then inadvertently slipped up and praised.
But a common Republican talking point is that we need to be fiscally responsible. We can't afford to care for everyone. If you look at the health outcomes of other countries and they're spending less money and getting better care, if you are not telling yourself a story, a lie that you just aren't going to pay attention to evidence, if you're reasonable enough to look at the evidence, this is
science, facts, interesting.
For a group that has denied climate change, that yes, it's
everything's scientific, and probably they got the Alex Jones guy or whoever it is that thinks the Earth is flat, and you know, and there's a crystal tower on the other side of the moon that you know, all these other fables that they buy, the Loch Ness monster, Bigfoot, yada yada yada, on and on and on.
We're a few miles from Sandy Hook, and they say that that was just a complete lie, which is
they do. A lot of them. That's one of their one of their things that they can't accept because it says bad things about people owning guns.
Yes.
Particularly people that have mental health issues, which might in fact include a lot of people that own guns.
It's something that to get rid of. They do say that, oh, we need more mental health coverage and not gun ownership restrictions, but they, in their American Health Care Act, are limiting or even eliminating some mental health coverage instead of providing more of it. But anybody who denies evidence, maybe you can't reach them, but anybody who can look at evidence, look at where health outcomes fall. Like, why is the maternal death rate so high in the United States? That's something.
We're way down the. You're right. We're way down the list. We're behind all of those at least 30 plus nations that have universal single payer. We have less longevity. People live shorter lives here in America.
Shorter lives, yes.
We have quality of health is poorer.
And this is all costing us more money.
Infant mortality rate, for those of us who like babies, infant mortality rate is worse in America than in all these other countries, and there's a reason for it. It's called HMOs. It's called not having health care that's dedicated to health care rather than profit.
Or even HMOs, it's some kind of healthcare access. There are people who can't get any health care, and this, the American Health Care Act also does a lot of defunding of Planned Parenthood. Planned Parenthood is perhaps the sole provider of preventative care, of obstetric care for women who are in low-income communities. They
breast exams for women that would die otherwise, that will die without clinics run by Planned Parenthood.
And that's something that undervaluing women's health is another common thing for the Republican health care plan. But it's something that is valuable to society. If you want to have society continue, you need to have a next generation. If you have low maternal care rates, if women can't access maternal care, if they can't get prenatal care for their children, that leads to worse outcomes for both women and babies and children during their childhood. It's
something as simple as a home visit by a healthcare profession after a woman goes home with her baby, which Vermont does.
Yes.
They have at least one home care visit by a healthcare professional just to make sure that things are going well and mom's getting better, the baby's is staying healthy. You're right, that saves incredible amounts of money later on.
Yes. And I mean, it just, as a society, we need to ask ourselves, what are we doing? What do we value? Do we really think that it's worth it to provide a huge tax cut to the 0.01 top % of earners versus providing care to people?
Here's a quick shout out to you folks out in the audience that are that like to poo-poo something called socialism. And all I could do is ask you, if you have two choices, if you are a socialist or an anti-socialist, which are you? And I think, given those two very clear differences, I think I would want to believe that most human beings, most Americans, given one or the other, would choose to be, would admit that they're socialists. They send their kids to schools teach our kids to play nice, to help everybody else, to not play this game of get rid of everybody else to benefit yourself.
It's not even a question, though, of socialism versus non-socialism. It's, if you have a billionaire, that's great. Be a billionaire. But why do you need to have a huge tax cut? Nobody's coming after your billions. Just pay your taxes. That's all anybody's asking. Going
back to a president by the name of Dwight Eisenhower, Republican. Back when Republicans were the more socially progressive party, which ended basically when Nixon went after the white racist voters in the South, the Dixiecrats.
Well, after the Democrats passed the Civil Rights Act. And
exactly. Well, the Republicans passed it, sent it to Johnson's desk. Johnson was a Democrat. Johnson signed it. Therefore, the Democrats passed it.
Yeah.
But at that point, going back to Eisenhower, the top tax rate was either 80% or 90%. And wealthy people understood that living in America had given them the opportunity to get wealthy. And they didn't mind giving back something to other people to continue this move forward by America and its middle-income workers, and keeping Henry Ford, not a great guy exactly, but at least he understood that
His employees needed to be able to buy cars.
His employees needed to be able to buy a Ford.
And that's something else. Like, if you have employees, do you want to be hiring people who haven't had access to health care for years?
And bringing their stuff to work, yeah.
Or do you want to hire people who you know have grown up with quality health care, who, if they have any pre-existing conditions, have been treated, and who aren't going to stay with you solely because you're providing health care? They'll stay at the job because they want to be there, because they don't have to be there for the health care.
Right. Eventually, people change jobs quite a bit nowadays, but when they find a job that they feel comfortable with and they enjoy doing, they're not going to leave for something other than, they'll stay in the job as long as the job continues to,
they stay in the job because
to reward them.
Yes.
Reward them. It makes them feel comfortable for what they're doing on the job.
Yes, and you can hire the best people for the position because, I mean, there are small businesses that won't hire people with pre-existing conditions either, or at least before the Affordable Care Act they couldn't afford to, because they're paying for a policy for 5 employees. They can't afford to add somebody who has potentially high health costs onto it. Whereas if you have universal access to care, that it could be single payer, we could work towards single payer.
So having a large pool of employees, I think what you're getting at is that having a larger pool of employees lowers the cost for the policy for individual employees.
Yes.
How about if you have a pool of employees which includes every person living in the United States of America? That's a pretty big pool, and that we know, and Henry Pietras has joined us in the studio, and he knows that the more people you have to ensure your costs go down. Likewise with buying prescription drugs, having the ability to pay more, to buy more, you get a lower discount rate. And this has been Progressive Soup. I'm David Stevenson, Sarah Kettler, and thank you for joining us.
Thank you very much.
And enjoy your afternoon, and we'll see you next Wednesday night. Thanks.